should invite people in. Good evening, everyone, and welcome. We're going to give it just about 30 seconds or so. It takes a second for people to come out of the waiting room and into the webinar, but we're glad that you're here. Thanks for joining us. Well, we'll go ahead and get started in respect to folks' time. So good evening, everybody. My name is Ben Adams. I'm Senior Associate Dean of Students for Quadex and the Director of New Student and Family Programs. On behalf of everyone here at Duke, let me just say once again, welcome to the extended Duke family. We're thrilled that your student will be joining us this fall, and we can't wait to meet you at some point down the road as well, whether that's during move-in process or at a family weekend or in some other interaction. Our office works year-round to make sure that you as a family are connected to support your student as they make both their transition to Duke, but also throughout their time at Duke. And so we offer a number of different ways for you to connect. One of the most important is this webinar series that we offer before your student transitions to Duke. Over the month of July, we're going to be offering multiple of these webinars. Tonight is the first, but there are many to come. And they'll just help you as you continue to support your student. There's a lot going on. There's a lot of moving parts. This is, for some of you, this might be your last student out the door. And so you are celebrating in a very different way than a person who this is their first child that's going off. And so we know that there's a wide range of questions. They might be Duke specific, but they might be more general about transitioning to college. And our hope is that we're going to provide you with some information that is helpful to you, again, as you support your student through the transition. Tonight's theme is wellness at Duke. And so we have a number of different offices that are represented here on tonight's webinar. We're going to walk you through some of the nuts and bolts of the practical things that have to be turned in, the tangible things that have to be turned in before your student arrives. But then we also want to give you a heads up of what's available to students during their career at Duke as well. I'm just for logistics sake, I'm going to be muting myself and turning myself off and going back, and I'll be answering a lot of your questions that are available in the Q&A. We encourage you to use that Q&A function that's down at the bottom. The chat is turned off for general chat, but this Q&A opportunity is a chance for you to ask questions, and we'll try to answer them as much as possible. Occasionally, if someone that's a webinar participant is on the call and is referencing a website, I may drop that into the chat function as well. But again, we're just trying to make sure that you have the resources that you need, and I'm going to pass it over to our moderator, Emery Sprouse, to take it from here. Thanks, everyone, for being here.
Hi, everyone, and let me be the second to welcome you to tonight's webinar. So I'll introduce myself. My name is Emery Sprouse. I am the graduate assistant for New Student and Family Programs, helping to facilitate the logistics for experiential orientation. So I'm going to pass it off to our panelists tonight. They're going to introduce themselves, their role at Duke, and their favorite wellness practice. And I'll start us off in order of speakers. So Crystal and Lynette.
Hi. So first of all, I go by Lynn Kenyon, not Lynette. So that's my fault. I have it on the screen, but that's, if you said Lynette, I would probably not even respond. But anyway, I am an immunization nurse at Duke Student Health, and I work closely with Crystal and with Ellen Crawford, who's the immunization coordinator. As far as my favorite wellness practice, I would say at this point is coming home and doing a good workout at the YMCA.
Hi, everyone. My name is Crystal, and I'm the nurse manager for Student Health. I've been with Student Health since 2010 and in the role of nurse manager since 2017. And I would say my favorite wellness practice right now is reading and doing some like self-care time management so I can keep things balanced.
Thank you both. All right, Calvin.
Hello, I'm Calvin Vini, the insurance care specialist here at Duke University Student Health. I've been here since 2017. And I handle medical and dental insurance related questions. Wellness practice for me will be still as many naps as you can, and make sure that you are practicing time management, because with insurance and some of the other university things that may go on, they are time sensitive. So you have to make sure you manage the time wisely so you don't miss any deadlines that may arise.
Thank you, Calvin. Tom.
Hey, everybody. I'm Tom Zigathy. I'm the Associate Dean Director of Do Well, which is kind of the public outreach branch of the wellness units. I've been at Duke since 2008. And I would say my favorite wellness practice, two of them would be, one is gardening and one is meditating on a daily basis whenever I can.
Thank you, Tom. All right. Tiara.
Hello, my name is Tiara Wade. I'm an assistant dean and associate director of Duke Reach. I have been at Duke since 2010. And I would say a wellness practice that I really enjoy right now is, I really like crafting. So like diamond painting is something that I'm into right now.
Thank you. All right, Ty.
I'm curious, am I the last to join? My name is Tymir Strong Luador. I am the Assistant Director of Communication and Outreach at Duke Counseling and Psychological Services. I'm also a licensed marriage and family therapist in there, so I work as a clinician with students. I've actually been at Duke now, yesterday made it 1 year, so I'm excited about that. And for my favorite wellness practice, and actually Calvin, I'm gonna follow up with what you said. I've been practicing more time management at the front end so that I am not burned out, stressed out at the end because of procrastinating.
Thank you. Awesome. Those were great introductions. And to be strategic about how we introduce what campus resources are available for your students, I want to start in the order that we just presented in with our speakers. We're going to ask them to share the most pressing information that you all as families need to know with helping your student transition to Duke. So I'm going to pass it back to immunizations and student health, Crystal and Lynn.
Okay.
Sorry, I was going to ask to starter questions too, so apologies. Tell us about the immunizations required and what information needs to be provided arriving at Duke, and what services does student health offer on campus? So sorry about that.
That's okay. So we have basically 3 categories that we send out. We have our undergraduates, our graduates, and our allied health sciences. And they're basically all the same. As far as vaccinations are all the same. There's a few things that are different for each category. And I'll just kind of go through them real quick. But undergrads, we require a Tdap and 2 additional tetanus. We require 2 doses of measles, mumps, rubella. We need a meningitis shot after the age of 16. We need a polio series if they're under the age of 18. 2 doses of varicella. We need a TB, this is for all categories, a TB screening questionnaire. And then for graduates, the only thing that's different is because of maybe their age or whatever, they may have aged out of like a hepatitis B series. All of this is on our website as well. And then with health sciences, basically the same thing that the undergraduates needed with an additional COVID primary series, which now is just 1 shot of the bivalent dose. They also will need to get an IGRA, which is a TB blood test, or a PPD, depending on which program they're in. Let's see, what else? As far as the resources go, our website, we just refer them to studentaffairs.duke.edu/student-health/immunization compliance. And when you click on that, it tells you everything that you need before you arrive to Duke, whether you're a graduate, undergraduate, and allied health science and whatnot. We also have a breakdown on that website of all of our deadlines, when to submit your immunization records. We also tell the students to allow 4 to 6 weeks for processing, because we have a lot of records to process. And our fall semester deadline was June 15th. And then they also know that they have 30 days after the first day of class to meet the immunization compliance. Crystal, anything I'm missing?
Yeah. So I'll answer question 2. What services does student health offer once on campus? So I like to say that student health is a mixture of an urgent care and a primary care office for students. We do ask that students have appointments to be seen. If someone walks in and needs to be seen, we will try to put them in an available slot, but there's not always a slot open right when they walk in. So it's better to call us in advance and speak with one of our triage nurses so that we can help the student have a predetermined appointment time so that they can be seen efficiently when they come in. We do have a couple different visit types. We can see students for international travel consults, allergy desensitization. We also have 2 nutritionists on staff at Student Health. The nutritionists are a little bit different from the rest of the clinic in that the nutritionist self-schedule. So if any student is wanting a nutrition appointment, we ask them to reach out to the nutritionist directly, and then they will help them schedule their appointments. We also, of course, have immunization nurse appointments for compliance vaccines, but also for other vaccines such as HPV or an updated like a varicella or Hep A or something like that if they might need it. We do have a full service lab as well as an X-ray tech on staff. And we do have 24-hour a day RN triage coverage. So if it's after hours and student health is closed, but your student has an issue, a question, a symptom, something that they're concerned about and they're not sure what to do, if the student calls our main number, that's 919-681-9355 and hits option 2, there will be an RN to pick up and provide guidance on what steps they should take. Oh, and one last plug-in. We also have, what am I trying to say? We have an agreement with the School of Nursing where we work with one of their courses called Flu Fighters, and they go around campus to different locations and they offer flu shots during the fall semester. So the students can get quickly and easily vaccinated for flu in the fall.
Awesome. Thank you both. All right. So now we're going to pass it off to student insurance. So back to you, Calvin. Can you tell us about the insurance plan and the waiver process and what information needs to be provided and when are those deadlines?
Yes, the deadlines for enrollment or waiver of the Duke SMIP or student medical insurance policy began on June the 15th and will end on September the 14th. Students will have that time period to submit any insurance information for waiver or elect to voluntarily enroll into the insurance policy before they're automatically enrolled after the September the 14th deadline. If you know, or if your students know that they want to enroll, please tell them not to wait to let themselves be automatically enrolled, because they will not receive their insurance information until at least early October, even though the insurance will backdate till August the 1st. If they enroll within that time period, it expedites the process for students to get their insurance information. If a student would request to waive, they would need to contact JCB Gallagher, which is an email that they were sent at the beginning of the enrollment period, June the 15th or 16th. It was sent to their Duke email account with a link for them to click to submit their insurance information for an insurance waiver if they choose to do so. The only issue with the link was there's a section that requires the student to put in their student ID. At the time that the website was created, it was supposed to say unique ID, So if the student enters their enters their student ID, they may get an error message. They have to submit their Duke unique ID number and their Duke email as the confirming email in order to access the system. The system will walk you through step by step exactly on what JBC Gallagher will need for the student to waive out of the insurance policy. Of course, the student's insurance will have to meet the Duke Health waiver requirements in order for the insurance policy to be waived. If any of the requirements are not met, the insurance waiver is denied and the student is automatically enrolled into the insurance policy. We do have a dental insurance carrier, which is new this year. In the last 2 years, we had Bright Dental Benefits as our dental insurance carrier. They have chose to leave the market area, so we are not enrolled with Bright Dental Benefits this year. It is with Aetna Dental PPO. So there's a broader network for students to receive dental care. That is an optional service. If students wish to enroll into the dental policy, they would have to do that through the JCB Gallagher link. There will be instructions on how to enroll into the dental policy. With the dental policy, they are given a $2,000 budget that they can use for dental services. So all of the services come out of that $2,000 budget. Once the budget reaches zero, then of course, the student will be responsible for any dental services after that. The Duke Student Medical Insurance Policy is a Blue Cross Blue Shield of North Carolina PPO plan. There are coverages in all 50 states. They're not limited to just the state of North Carolina. There's also coverages for international if they are doing a study abroad program or just happen to be vacationing in various countries. There is access for emergency services. With that being said, they're part of the Blue Cross Blue Shield network. Like I explained, they have coverage in all 50 states, so they're not limited to the state that they would be in. I believe it is an 80-20 policy. The insurance company will pay up to 80% of all medically necessary services, with the student being responsible for the remaining 20%, unless the out-of-pocket maximum is met, which the out-of-pocket maximum is $2,000, and anything that's medically necessary after the $2,000 out-of-pocket maximum, Blue Cross Blue Shield of North Carolina will pay 100% of medically necessary services. Other than that, that pretty much describes the health part of the insurance and the dental part of the insurance. We do inside of student health with the health fee. We do not bill the insurance unless your student is getting labs, x-rays, immunizations, or vaccines. So inside of student health with a paid health fee, they are able to use student health services without any charge to the insurance. That is the same for CAPS or Duke Well and Duke Reach.
Thank you, Calvin. All right, we're going to pass it over to Tom. Tom, can you tell us about what services does Duke Well offer for students, and how is this different from other universities?
Sure. Duke Well, like I mentioned earlier, is kind of the public outreach side of things. So we do programs and we do workshops for students in 3 different areas. One is risk management and teaching students how to manage risk around choices they may make around, some of that is within relationships and also with substance use. Obviously, policy and our recommendations is that if students are underage, that they don't engage in substance use or alcohol or drinking. But we also know that students are going to make their own choices. So we teach them a harm reduction, how to understand the science of alcohol, what's happening in the system, and how to do so safely. We have wellness promotion that we do in programs across campus. The number one or top 2 things that impact academic success on a wellness basis consistently has been stress and anxiety. So a lot of our programs is trying to help students to gain more tools in order to manage their own stress and to hopefully lower their anxiety. And those are under the umbrella name of Moments of Mindfulness, which is a program system that we have where student leaders come in and they teach students activities that they do that really drives their own passion and helps them to mitigate stress. I don't know if you're aware, but in our country in general, the craft industry came out after World War II in order to help soldiers deal with PTSD. So a lot of the programs that we offer in the Moments of Mindfulness arena are craft oriented, where students can really get into creating things with their hands. It helps them to stay in the present moment, not worry about past or regret the past or worry about future. And they find a space where they can really attain this level of happiness and serenity as they're dealing with a lot of different entities and things that come at them when they're at Duke and the business of campus. We also teach group health coaching, which helps them to navigate through the different dimensions of wellness and ways to approach them in developing their own system in order to manage different areas of wellness. And we offer a meditation workshop called Koru, which is a 4-week workshop that students can take. It's non-credit bearing. That'll give them 10 different breathing exercises they can use to begin a meditative practice. And the reason that we focus on meditation is anyone who science has told us, anyone who does practice meditation on a regular basis tends to have a higher level of self-compassion. They manage stress better. They actually have a higher level of immunization. And these are all of the pieces that we want our students to have on campus in order to be successful. Meditation, as the science shows us, also helps us to actually reconfigure our brain to work more efficiently when we're trying to approach tasks and manage stress or a really active schedule. So those are all practices that are available to students free of charge. It all is paid for through the student health fee, all those programs. Students don't have to register for the programs. For the Moments of Mindfulness, they do need to sign up for a Koru class if they choose to take it. And all of that can be found on the Do Well website.
Awesome. Thank you, Tom.
You're welcome.
I'm going to stop us right here to ask one question live from the Q&A. So if a student waives Duke Health Insurance and has their own coverage, will they still have access to that student health center?
Okay, I'm sorry. Can you repeat that one more time?
Yeah.
I was answering the chat. I'm sorry.
Yeah, if a student waives Duke Health Insurance and has their own coverage, do they still have access to the student health center and the resources there?
Yes. So they can use their own insurance coverage. What we look for them to be able to use student health or CAPS is a health fee. On the account, there's 2 different charges. There's a health fee charge and there's an insurance charge. The insurance charge is for their major and minor medical situations, which if the student waives the student insurance policy, as long as that health fee is posted on their account, they would be able to use student health, CAPS, Duke Well, and Duke Reach for services.
Thank you, Calvin. All right, we're going to keep on. I'm going to pass it back to Duke Reach with Tira.
Hello, my name is Tierra Wade. Like I said before, I'm the Associate Director of the Office of Duke Reach, and our office supports students who are experiencing academic, health, or personal obstacles, and then we connect them to appropriate resources both on and off campus. And we provide services that kind of encompass like all the different areas of wellness when we are connecting students to support services. We also provide what's called like non-confidential, non-clinical case management. So we are able to keep things private, but in order to provide services to students, we're able to keep it confidential. So if you're concerned about a student and you want, like say, if as a parent, you're concerned about your child and you want somebody to check in, we're able to reach out or get eyes on your student. And again, I want to add to that as well. Like it's okay to be concerned about our student. I know sometimes we'll get calls or emails, we'll be contacted by families that are concerned about their student, but they'll say, oh, but I don't want them to know that I'm concerned that I said something. But it's okay to be concerned. And it also helps us when we're reaching out, just letting that student know that someone is concerned about them or someone's worried or someone's noticed a change of behavior. And we just want to make sure things are okay and that we can connect them to services that might be beneficial for them during that time. Anybody can fill out our online form if they have a concern. Students are able to fill it out. You don't have to be affiliated with the university, parents, sometimes faculty and staff use it. When we get a concern, we will reach out to the student. And again, we let them know what the situation is, what some of the concerns that were observed. And then we let them know what resources might be helpful for them or what some things that might be help them to continue to be successful at Duke. You also can consult with us at any time. So if there's questions, you're not quite sure, how to approach a certain situation or how to let somebody know that you're concerned about them. We're always available for consult. You can always call our phone number, which if somebody can put in the link to our website that has the link to the Duke Reach form, our email, and then our phone number as well. So you can always reach out.
Thank you.
Thank you.
All right, last we have Caps with Ty.
Awesome. Thank you all so much. So when students come into Duke, whether they are undergraduate, graduate professional, they all have access to free confidential counseling services, right? And so this includes our brief one-on-one therapy model. This includes group services. This includes psychiatric services, crisis assessments, referrals to the community. We try to provide many of the things your students may need when it comes to mental health so that they'll find that stuff within us. The Gender Violence Intervention Coordinator is also currently housed in CAPS right now. She has a 24/7 line that she monitors all the time. It allows students to call in if they need to make reports, see if there needs to be a consult, and she can schedule things that way. And for students who may be outside of state, so let's say, summer breaks coming up, they may have been with us, but now it's time to see a new counselor. And most of our counselors are licensed only within the state of North Carolina. We have Timely Care. Timely Care allows students to interact with peers via the Chat Now function, but they also allow students to connect with mental health providers in their area. And I believe it's about 4 to 6 sessions that may be covered free while they're there. And so it gives them that help to transition into something else before they're able to come back to us.
Thank you, Ty. Cool. So from your vantage point, what is something that you all would tell families as a piece of advice, as sharing your essential and really important information for them tonight in getting their student prepared? What is one advice, and this can be something we unmute just to share, but advice for families in helping and supporting their students holistically, and in the lens of wellness? How can we help encourage that support?
I'll speak. I think the biggest thing, having 2 children that have graduated college, was letting them know that their school actually had a place where they could go if they were feeling anxious or overwhelmed, or they felt like they needed to speak to somebody, that they were just not in a bubble by themselves. And so getting that information out there, whether it's in a dorm or whether, I don't know where, but just making sure the information is out there so they understand and know that there is a place they can go. If mom and dad can't be reached on the phone, they can go somewhere and talk or have a breakdown, meltdown, whatever they need to do, or just vent, whatever. But just knowing that there is a place where they can go.
Mom and dad, please don't worry. We'll try to take care of your babies and treat them like they were our own kids. Because of course, some of us have kids that are either A, going to college, or B, are already in college or graduated from college. So we understand exactly what you guys are going through. The only thing I will recommend is tell your students to please, please, please check their Duke email when they receive their emails, because things are time sensitive. And when the student receives it, we get notifications that are date and time stamped down to the second. So the last thing we don't want to hear is that I didn't get it. We can tell when you received it. We can tell when you've opened it. So there are things that are time sensitive as far as immunizations go, with insurance waivers. Those things are time sensitive, and we can tell when you haven't opened up the email. We do get notifications that tell us that you've never opened the email, so we can tell if you've read the email or not. So please please, please make sure that you follow through with responding back to your emails. It's much easier for us to fix the situation than for you to say, I didn't get the information well after the deadline is over and we can't do anything about it.
And I would, build off of what Lynn was saying in regards to having a student reach out to people. There's staff within the dorms, there's staff in the wellness center, there's staff in all over the place that are willing and able to help out students should they be struggling with anything. I think the students that have the hardest time are ones that are unwilling to talk about something they might be struggling with. And if they talk early, usually the problem is much smaller and it's easy to manage than if they wait and wait and wait, and then it becomes a crisis. So the earlier, the better. They're going to definitely build a community within orientation and all the peer orientation groups. So they're going to feel like they have their friendship circle within the first week of the semester, which will help a lot. But certainly utilize the people around them to talk through any struggles they might have.
And to submit Tom's point, for some folks, when you hear that, it's always like, well, that sounds good, right? There's someone for them to talk to. No, there's actually someone. So here we have a model where every resident coordinator, so every person who oversees an RA has a liaison for CAPS. And so they have a connection to know, okay, if this student is experiencing this, what should I do? How should I approach this with this student? I have a student I may need to refer for services. How can I do that? So your student definitely has someone they can go to, and they will know exactly how to refer them for the appropriate resource that they need.
Awesome. I also have a question for you, Ty, from the Q&A. So I'm going to start pulling questions from the Q&A and having our panelists answer. So with CAPS, how quickly can students connect with someone if needed?
That answer can vary. And so what we often tell students is, if you know that you are wanting services, come in right away, right? Because when we're first starting in August, we don't have that many people. There's a quick turnaround. You can get your track assessments one day and then be with your counselor the next day, right? But as the semester progresses, sometimes there's going to be a week or two in between your initial session and then you meeting with your counselor. And here's what I mean with your initial session. When a student walks into CAPS, they're going to fill out some paperwork. It'll take about 15, 20 minutes, but then they'll meet with a track counselor. So every student who walks in, they are seen on the day they walk in. That track counselor will be able to assess what's happening, hear what's happening from the student's vantage point, and then they collaborate on what services will work best for them. And so in that moment, students are able to talk about it. And then there's a triage taking place too, right? And so if this student is crisis, maybe we need to get this person on the schedule right away. This student may want to work with somebody who's more identity focused. Sometimes that may take a bit more time, but oftentimes we are getting students on our schedule in a week or two.
Thank you. And Ty, where is CAPS located?
We are located on the 3rd floor of the Student Wellness Building. And the Student Wellness Building is located on 305. Sorry, I'm a Miami girl, so I love saying that. Tower View Road.
Awesome. Thank you, Ty. I've got a question for Calvin with insurance. If a student is under financial aid, then would all medical and dental costs be covered, or would that student still be liable for costs?
That is a financial aid question. So if the student is under a need-based financial aid and they need to be enrolled, meaning if a student has insurance policy that doesn't meet the Duke Health waiver requirements and the waiver is denied, the student is under financial aid, they can reach out to their financial aid counselor. Their situation is then reevaluated, and then financial aid can allot the funds to help cover the cost of the insurance policy. Now, any medical services that are billed under the insurance policy, financial aid does not cover that. That is based on the insurance and sent to the student. They can allot the funds to cover the cost of the insurance policy, but they, number one, would have to be need-based, and number two, they have to have an insurance policy that will not meet the Duke Health waiver requirements. A prime example is a Medicare, Medicaid plan from another state. HMOs, Medicaid and Medicare plans don't have coverage outside of the home state. So they're home state specific. So if you're not in the state of North Carolina, then of course, any state outside of North Carolina, you would not meet the Duke Health waiver requirements. So that in that case, the waiver would be denied and then you would be automatically enrolled. Like I said, financial aid will then be able to reevaluate your situation and then take under consideration that you are a need-based student, and then they would be able to allot the funds to cover the cost of the insurance policy.
Thank you, Calvin. We have one more question in regards to insurance. If a family has already waived the insurance of the student and received confirmation via email, should they be expecting a charge for that?
All students were billed for the insurance policy upfront. The reason why students are billed for the insurance policy upfront is because it's a snapshot of what you would owe if all the charges would stay on the account for the fall. So that way there's nothing hitting. So they don't want to send you a partial pay or a partial statement and then come back later and say, oh yeah, by the way, you owe for this. Oh yeah, by the way, you owe for a room and board. Oh yeah, we forgot to add your meal plan in. So for some students that are not wealthy, I want to say, it's a way for you to see exactly what your total bill would be in the event that those charges would stay. So that way you can make your necessary financial adjustments. Now, of course, if charges are removed, the bill would change and of course the price would go down. So in this case, if the student was issued an insurance waiver, when we'll say they're already paid the bill, then of course the bursar's office or cashier's office would issue a credit or refund of the cost of the insurance policy. If they have not made the bill payment in full, then what will happen is they'll just subtract the dollar amount for the insurance off of the billing statement, which means the billing statement will change. And then of course the bursar's office, you can make your payment arrangements or set up any kind of payment arrangement with the bursar's office minus the insurance charge, because you have an approved waiver and have confirmation of the approved waiver. It just doesn't reflect real time. So if you did a waiver today, they're not going to remove the charge today. It takes a couple of days for the system to update changes and for the information to transfer back and forth. So we always normally tell students at least 3 to 5 business days. It may be a little bit longer because we're coming off of the July 4th holiday and there's no processing on the weekends. So depending on if there was employees that may have taken off on July the 3rd, some of the areas may be a little shorter staffed because of the holiday weekend. So of course, there's no processing on Saturday, Sunday, and there wouldn't have been any on Monday or Tuesday. So the first processing day would have been Wednesday. And then of course, today is Thursday. So in that case, you know, it won't reflect within like 2 days. You have to give them time to catch up and process all the information. But per the bursar's office, I've actually heard them say this before. If you're granted an approved waiver, just subtract the dollar amount for the insurance off of your billing statement and then make your payment for your charges minus the insurance.
Thank you, Calvin. All right, we have a question for our folks in immunizations and student health. For our Duke families who are abroad and our international students coming over, if they need to, by chance, get a second meningitis shot or need to get their shots in coordinates with Duke Health and making sure they're in compliance, how can they arrange to get those shots?
So they can actually call the student health number 919-681-9355, option 2, and schedule an appointment. We are having an immunization event for international students that need TB screening and to catch up on some vaccination compliance that they couldn't get in their country or whatever. And that August 17 and 18 and then 21 through 25, is that right, Chris? So, okay. So during that time, and that's held at Penn Pavilion. So it's a walk-in clinic, no appointment necessary. So they can just walk in, get there early, very early, or you'll stand in line all day. But you know, they can get their vaccinations and their TB testing then, and after that, then they'll just make the appointment at Student Health.
And I'm going to add in real quick, we actually are having an event specific for first-year students on Saturday, your move-in day. We will be in Penn Pavilion from 11 to around 5. I think you all have a picnic that evening. So we are going to be in Penn Pavilion on Saturday of move-in day starting at 11 a.m. And we actually do have appointment slots for that day because you all are going to be very busy during move-in. So that information should come out to you shortly with a link for you to sign up for a specific time slot so we can kind of stay on track a bit better for move-in day specific. But if you do arrive early and you want to come see us in Penn, we will be there on Thursday and Friday from 9 to 3.
Thank you. So we may have another question for you both. What forms do parents need their new to Duke student to sign to provide them access for health and or academic information due to privacy laws? Where can families find these forms and do they need to be signed yearly?
I can answer that question for the health part. Regarding academic records release, I'm not sure who to talk to about that, but for regarding their student health visits, we do have a form on our website that is a release of information. So the student would need to fill that out and indicate what information they want shared and with whom. The student can sign that form, and it is good for a calendar year, but you can specify the length of time on the bottom of the form. If no length is specified, then it'll be good for 1 year.
Thank you. We have another insurance question for Calvin. Does Duke accept private dental insurance? And can you also talk, if you do know, what is included for vision, if Duke does that?
Dental is optional. So as far as you're not enrolled in the dental, you would have to voluntarily enroll in the dental unless you're an international student on a visa. A domestic student can choose to opt in for the dental coverage, but are not required to have it. An international student on a visa is automatically enrolled into the dental policy, but can waive out of it if they don't want it. We have a fully functional dental office here on campus inside of the wellness building down on the first floor called Campus Smiles Dental. They can do everything a traditional dental office can do. The only thing that they don't do in that office is oral surgery, because that's a little bit tricky. That becomes more on the medical side because it may require unconscious sedation. So that dental is there for anybody with dental insurance that they want to use. Vision, on the other hand, is not a separate entity like the dental is. It's part of the Duke SMIP. Under the vision benefit, students have one fully covered eye exam for 1 calendar year. And if they need to purchase glasses or contact lenses, then they would have to pay for those up front. But they would be able to complete a claim reimbursement form that is sent back to Blue Cross Blue Shield, and then Blue Cross Blue Shield would send the student back a reimbursement check of up to $100 for glasses or contact lenses, or both if they're under the $100 mark.
Thank you, Calvin. All right.
So I'm sorry, I meant to say that if they purchase the glasses or contact lenses, for instance, if it's $150 for the glasses or contact lenses, then of course Blue Cross Blue Shield will just send you back the 100. So you would just, in essence, be paying the 50, but they would reimburse you the 100.
Thank you, Calvin. All right, we have another question for Ty and CAPS. Can a student meet with a CAPS counselor or have an initial session prior to arriving on campus if they know they will want counseling services? For example, can they meet with someone over Zoom now to get assigned someone before arriving and schedule a meeting for the first week?
No, so unfortunately, students have to be currently enrolled to receive our services. So that is one of the mandates that we have, current enrollment.
Thank you. I guess this is a question for all of our panelists, but are there any services available for students prior to move-in day?
Can you repeat your question?
Yes. Are there any services to your all's knowledge that are available to students prior to moving in?
There will be a wellness module sent out to your students. July 15th, it'll go live for them to complete before they arrive on campus. And that's really a survey around substance use practices, and it's a training that we use as a workshop to help them to identify risks. So that goes out July 15th, and it'll be available throughout the following month.
I would just add to that the health fee that everyone pays for each semester is effective August 1st. So if they're in the state of North Carolina and or in Durham and need services, then like they could call student health for an appointment if they needed a medical appointment after August 1st.
Thank you. So one question. Okay, this may be a question for Lynn and for Crystal. What should we use for medical record number on HIPAA forms?
Leave that blank. That's not something that you're expected to know. Just leave that blank.
Another question related to insurance is Duke Health Integrated Practice in network considered enough for Duke medical waiver? I think you're muted, Calvin.
I'm sorry, I thought I already answered that question in the chat. But integrated is more for specialized services. They're not primary care related services. So they're considered a specialty. In order for the insurance to be waived, it has to be for medical emergencies and let me try this again. 3, 2, 1. It has to be for emergency and non-emergency services, meaning non-emergency is like primary care, cold, flu, sinus, minor aches and pains, cuts and bruises. When you start getting into integrated services, they're specialty services, kind of like a rheumatology, cardiology, dermatology, something like that. So that's what integrated is. So that's not somewhere you would go for primary care related services. It would be student health or Duke primary care or Duke diagnostic clinic, something like that would be what the waiver would in terms of detail on what would meet the Duke Health waiver requirement.
Thank you. All right. Well, we are getting close to time. I have one more question that I would love to hear the perspective of our panelists tonight. And we'll start with the same order. What are the best, or where's the best place for students to go to learn more about these resources? And if you would share maybe another piece of advice, you can't hope for more tips for our families that will be joining us this fall. So we'll start with, again, Lynn and Crystal.
Resource-wise, Student Affairs website, hands down, as far as, immunization and, it breaks it down into categories as well, so they can decide what they need based off the categories. I would say, as far as advice, being the mom of 2 kids that were in college at one point, I think the time when you thought things were going really well because you never heard from your kids, or I should say, you never heard from your kids, so you thought things were going really well. That's when things are going really bad. So reach out to your kids, stay in touch, communication, check on them, just make sure they're doing okay.
And I would say, just to kind of piggyback behind Lynn, encourage your student to balance things. So have balance between studying and social time, work, school, and sleep. Sleep is definitely mega important, and hand washing.
Thank you both. Very important, Crystal. All right, Calvin.
I can only piggyback off of Crystal and Lynn. Just kind of check in on your students periodically to make sure that they're okay. Please, please, please wash your hands. Cover your mouth if you have to cough. I'm sorry, I'm a germaphobe. I get on my own son when he doesn't do those things. But please make sure they stay on top of it. Like I said, we're here to help. The only thing the student has to do is reach out. Don't be too prideful to say, hey, look, I need some help with something, whether it be something mental health related, whether it be something physically, where, you know, they can come into student health, or just be willing to reach out and say, hey, look, you know, I'm struggling in this area. Do you have any ideas? You know, is there something that I can do that will better my situation? Students sometimes feel as though they can't reach out because they're ashamed of what people may think of what they have to say or what they do. That's not the case. Like I said, we're here to help. We're here to listen. We're here to advise if we can. So tell your students, don't be so prideful. Just reach out if they need it. And wash your hands again.
And I agree with everything that's been said. I would say in addition, most of our students completely understand the idea of doing physical wellness and working out 2-3 times a week. I would ask your students before they arrive to campus, what do they plan to do to be emotionally well? And often they don't have as elaborate an answer for that. There are a lot of programs and things they can join when they get to Duke if they don't know about it, to learn about that, but to have some level of a plan. How do they decompress? How do they manage their stress? Obviously, sleep is a huge piece with that, but there's a lot of other tools that they can add to their toolbox along the way.
Thank you, Tom. Pass to Tiara.
Yes, so not so shameless plug for my office, Duke Reach. When it comes to resources, we're a really good place to start off with, especially if you're thinking about like all the different things that are available, or if you have a lot of needs, maybe something might be complex. We're a good place to start. We can kind of talk through what some of your needs are and then what resources might be appropriate. And as far as advice, for a lot of times I hear from students, they'll say like, oh, well, I feel like what I'm going through isn't serious enough to speak with somebody at CAPS, or, you know, I don't want to bother anybody. My problems don't reach like this particular level. And I would just say, you know, those resources are available to everyone. And there's resources that are there to help everybody. And so don't ever but your student think that their problems are too small or not serious enough in order to reach out and get support.
Thank you. All right, Ty.
All right, to round it out, shameless plug for the Duke Wellness Instagram page. Student Affairs website is great. Also, though, if your student would like to know things that they could do, the wellness activities that are taking place, follow the Do Well Instagram page. Can't wait to have you as a follower. Now, in terms of advice, first for the students, 8 a.m. in high school is very different than 8 a.m. in college. Get to know it, because being up at 3 o'clock in the morning and just being able to go to school feels very different in college when you're sitting in that lecture hall. So be mindful as you're looking at your schedule. The other piece, and this would be for parents, is starting to have some conversations and getting your student comfortable with productive struggle, right? And so college is a transition within itself. And so things are not going to always feel as great. And you're not going to always knock everything out of the park right away, but just being comfortable with the process that is moving to college and starting to learn yourself in college, and understanding that there may be some difficulty, but there is support, and knowing how to seek out that support.
Thank you, Ty. I'd like to thank all of our panelists for joining us tonight, and for all of the new families who are going to be joining us this fall. I'd like to remind everyone that the next family webinar will be on July 11th that will go over student safety. And I'd also like to remind you that this will be a recorded and available to you all within the next coming days. Again, thank you all for coming, and we're excited to see each of you on campus this fall. So until then, keep tight, keep safe, and we'll see you then. Bye.